The ulnar collateral ligament of the elbow is an important stabilizing structure, particularly for overhead athletes or throwers. This is more commonly known in baseball circles as the Tommy John ligament, and often with the extreme repetitive stresses of elite level throwing, the ligament can attenuate and tear. Fortunately, the results of Tommy John surgery or ulnar collateral ligament reconstruction continue to get better and better. And in some cases now, actually I'm performing something called an internal brace repair, where if there's particularly a cleaner tear off one side of the bone rather than the stretched out and kind of torn up ligament, we can actually repair the ligament primarily. And this seems to offer an accelerated rehabilitation. That being said, cases where the reconstruction is needed, we are still seeing good results with eventual return to high-level throwing. And there are some other nuances to these procedures that we can talk about in the office. In some cases, partial tears can actually be treated with rehabilitation before we even talk about surgery. So it's important to understand the extent of your injury and where you are in your career and what the best treatment option is for you as a thrower.